Welcome to the last and most important module, which is going to building and governing AI. To take us through this topic, we have one of the globally eminent speaker, Dr. Rajendra Pratap Gupta. He is recognized as visionary leader in digital health, AI, and healthcare transformation. With over 3 decades of impact, he has shaped global conversations at the intersection of technology, policy, and healthcare delivery. He is a creator of functional AI pyramid, which we are going to hear from directly from the inventor, which is an emerging global framework guiding AI maturity from conversational system to organizational AI. Dr. Gupta has contributed across major global institutions, including the UN, WHO, Commonwealth, ITU, World Economic Forum, and WTO. He currently chairs Global Commission for 21st Century Healthcare, working to redesign future-ready, equitable, and intelligent healthcare systems. As advisor to India's Union Health Minister, he played an important role in advancing India's National Health Policy 2017 and digital health ecosystem. He is the founder of Health Parliament, chairman of Academy of Digital Health Sciences, and summit chair of Global Digital Health Summit. Through his best-selling book, Digital Health, Truly Transformational, and a global advocacy, Dr. Gupta continues to influence the future of healthcare worldwide. Welcome, Dr. Rajendra. And to moderate this session, we have Dr. Venkateswaran Mahadeva, fondly called as Venkat. He is the founder of IgnitAI, a learning solution company providing high-quality learning experiences in the field of AI, machine learning, and data analytics. It's a training and consulting company with deep expertise in providing customized programs crafted by practicing professionals for 3 consumer segments. Number 1, young professionals and students. Number 2, mid-career professionals. And finally, the senior management. With over 2 decades of experience, out of which 20 years in the analytics and insights, he is one of those people who guided Fortune 100 companies, and his major areas of strength are creating analytics framework and building AI and ML solutions in financial, healthcare, life sciences, travel, transport, hospitality, and manufacturing segments. So, Dr. Rajendra sir, please let our viewers know what they are going to hear and how you are going to educate them on 10th of June, this Wednesday, 4 to 5 p.m.
Thank you so much. And it's a great opportunity for me to be with you and to be speaking to clinicians. I believe that we will not be doing things that we do today by 2030. None of us. None of us at all will do those things. But why? How? I think in this 1 hour session that I have, they will walk away with understanding digital health in totality and also in granularity. So you get the larger picture, you also get the granular vision of what it is. I also want to dwell upon the AI maturity model that I have developed. And this is very interesting. A lot of people are excited about AI without understanding AI. I will walk them through 5 levels of AI, from AI that is talkers, AI that think, AI that does, AI that innovates, and AI that leads. This is the original terminology. And in this 5 levels of AI, I'm going to walk them through what it applies to in clinical practice for an organization in healthcare, how they can be future ready. If you get the 5 levels of AI right, you can never go wrong. I think I'm excited about this workshop, and I am sure that they will walk away enlightened on 5 levels of AI and how it will impact them in the next 3 years.
Welcome, Mr. Venkat. It's very good to hear from Mr. RP Gupta that there is a 5-layer thing. How is it applicable at a hospital level, and what are the blind spots which you are going to moderate and help our viewers to do?
At the outset, Dr. Suresh, thanks for inviting me as a moderator into this panel. Right. To answer your question, Dr. Gupta's 5-layered pyramidal model on AI is a perfect fit for hospital administrators and owners of hospitals and doctors who want to embrace AI into the hospital, implement AI in a phased manner. So at the outset, the layer number one is called the conversational AI. So where hospital administrators and doctors could take recourse to large language models like ChatGPT or Claude or Grok, etc., and they could ask queries to that, right? So at that level, the hospital operations don't get disrupted, right? It's just a value add at level one. Then we go to level two, right, where certain functions like accounts, billing, dealing with insurance companies, etc., are easily amenable for automation by AI. So autonomous tasks in these departments can then be taken up at level two. Level three is where human and AI meet. The collaborative effort of AI with doctors and hospital administrators starts at level three in Dr. Gupta's framework, right? So over here, what happens is that certain departments are completely automated end to end by AI, right? For example, billing is, or accounts is another department which can easily be automated with the human AI collaboration. Let's remember that at level three, it's again the human in the loop who has the control to override what AI provides as its insights, right? Then we go to level four, where end-to-end functions in specific departments can be automated. For example, the X-ray department or the bone densitometry department. These are all departments where AI can layer itself over those departments, and it can read the reports, etc., provides its observations, insights. So at level four, again, human can only override what the AI says, but 90% of the work is done by AI. Then comes the maximum level, the level number 5, where the hospital attains the highest maturity, where AI takes on the role of a strategy leader, right? So the financial planning, the strategic planning for the upcoming financial year, all of that is end to end. The hospital administration is taken up by the AI, right? And let's remember here that 99% of the work would be done by AI, but there would be again the duty, the obligation of the hospital administrators and doctors to have the human in the loop, because that is anyway mandatory in any AI implementation exercise. And you also asked about some of the blind spots that the hospital administrators and doctors have to be cautious about, wary of while implementing and embracing AI in their institutions, right? To me, the first thing about AI that we have to understand is that AI is a pattern recognizer, right? It cannot give you a 0 or 1 or a black and white solution. It is probabilistic in nature, right? Therefore, keeping that in mind, most of the large language models have this disclaimer in fine print saying that, AI, you cannot take the answers provided by AI at face value, right? Hence, the blind spot that one has to be always cautious about is the domain expertise always overrides the output produced by AI. So the role of doctors, the clinicians, the nurses, and also the hospital administrator continues to be enhanced with AI as the co-pilot to help them, to support them, enable them take the right decisions.
Thank you very much.
Thank you, Dr. Suresh.